first thing to say this morning after the first two speakers is, oh dear. I hope you weren't expecting a pick-me-up after, particularly after Linda's talk and as a sort of prelude to your coffee. I'm afraid I don't have really great news. But what I can say is that what I'm presenting on is really about implementing a proportionate public health response to an issue that has beset us in Glasgow City. So, taking away the chaos, the case for Scotland to implement the UK's first drug consumption room, actually the case for Glasgow to implement the first drug consumption room in the country. And this is really a public health initiative. Mark Rogers and Emily Tweed, who are both working in public health in Greater Glasgow and Clyde at the time, really did the bulk of this work with support from Amelia Crichton. But it's been a partnership and a co-produced piece of work with many other individuals involved and with expertise from outside Glasgow as well. What I propose to do just now then is to take you through the background to the Glasgow proposals, and the background really is in a public health needs assessment which we published in a report called Taking Away the Chaos. I want to talk to you a little bit about safer drug consumption facilities and what they might be, and I want to tell you about what our current status with regards to that work in Glasgow is, though I suspect any of you who follow the news will be familiar with where we are with that at the moment. Okay, so I like to show this slide particularly to foreign delegates, or when I'm speaking abroad, to soften the blow really around what I'm about to say about Glasgow in the following slides. And yes, in a morning like this morning, this is what Glasgow looks like actually. And I know that many of you are proud Glasgow citizens like me. And you know, it is a very good city to live and experience life in if you have secure employment and at least median income, etc. But our city slogan is "People make Glasgow," and you know, sometimes I do wonder if the people that I'm going to be talking about are included in that slogan. And part of our work really is to raise awareness that actually the city should be for the benefit of everybody. And I think there's a seamless link, obviously, from Linda's presentation onto this, because you saw the contribution that drugs is making with regards to mortality, but also people with, I'm sorry, somebody's phoning me just now, and I'm just going to deal with them right now. I'm speaking at a conference, stop. So also we know that in terms of ACEs, I think it's 4 ACEs or more are linked with an 8-fold risk of becoming an intravenous drug user. And of course, the socioeconomic status of drug users in Glasgow City is well documented, and I don't need to go too much into detail about that. So the background to our work is really about public injecting. That's the background story. I could take any of you for a short walk from this building, and we could find a site like this. This one is off Sauchiehall Street. I took this photo with my phone, walking just past the CCA in Sauchiehall Street not that long ago. And you can see why this would be a risk environment for individuals. So you can see the drug paraphernalia, including a freshly used needle right in the middle, but a whole range of other things going on here involved that result in a very sort of risky lifestyle. And this was a site which was actually relatively small. 3 or 4 people were sleeping in this site, using drugs, alcohol, and volatile substances, and actually using the site for toileting and all their day-to-day activities. And there are many sites hidden across the city like this, particularly in the lanes and in the city. And now, as well as these small sites, they are actually huge sites where thousands and thousands of needles are found, often on the edges of the city, particularly heading eastwards. So we've been aware of public injecting, and the population involved in public injecting have been really at the centre of many sort of health outbreaks, injecting related health outbreaks in the city. For a number of years, they're individuals who are very much at highest risk of being of suffering a drug-related deaths, and also because we commission and manage the injecting equipment provision in the city, we are often the first port of call when there are complaints from residents and businesses about discarded litter or actual injecting in public places. So for an example of that would be a restaurant or a cafe. When their staff come in and open up in the morning, when they go to take their rubbish out, they'll find discarded litter, or they'll find 2 or 3 people huddling together and actively injecting in the morning. So we've had a whole range of responses in the city to these situations for well over a decade now. And we have done everything we can to try and manage the problem and reduce the impact on drug users and city residents and businesses. And the question of a drug consumption room and heroin-assisted treatment and other more controversial responses has been on the cards for a number of years, but really has not been supported and taken further forward until after 2015. And what changed then was the outbreak of HIV in people who inject drugs in Glasgow City. So as you can see, that after the crisis of the 1980s, there's actually been a relatively good control of incidence of HIV in people who inject drugs in Glasgow City. All across the 2000s, we start seeing flickers of new cases in the early 2010s, but in 2015 we saw 47 new cases, and the outbreak now continues. It's now reached a population of over 150 individuals who are infected by HIV. When we did our first set of interviews with the newly diagnosed HIV population, 2 clear risk factors emerged. One was the Glasgow City Centre, and the other was injecting in public places in Glasgow City. Now, of course, there was cocaine use and there was high-risk behaviours in terms of sharing paraphernalia, but it was very, very clear that this was a Glasgow City Centre public injecting population that were at highest risk. And so Public Health in Greater Glasgow Clyde came on board, and we initiated a formal health needs assessment. I just want to draw your attention to actually the outbreak continues, but as well as that, we've had year on year since 2015 very significant rises in drug-related deaths in Glasgow City. And really it's the central grey line with the blue boxes that you need to concentrate on. And you can see that we were actually beginning to have a levelling off of drug-related deaths, and maybe even a slight reduction in about 2000 up till 2014. But since 2015, we've had very large rises in drug-related deaths. And this population is, as I said, the ones most at risk of drug-related deaths. And we've looked at mortality rates of the HIV diagnosed population, subpopulation within that, and it is double that of the rest of the drug-using population that we have contact with. So this was a report that was published, Taking Away the Chaos. The methodology involved looking at local data around drug use and public injecting. It involved an evidence review, and it involved a consultation with people who actually work with drug users, primarily in Glasgow City Centre, but also with active drug users, street drug users as well. really going speedily through the report. So the report showed us that actually we haven't been asking the question about whether people inject in public places or not. None of our data sets have asked this question until now, but the best guesstimate we could make at that time was there were about 400 to 500 individuals involved in this behaviour in Glasgow city centre, that they were predominantly male, they're predominantly Scottish average, and they're that cohort of the ageing cohort of drug users, what the newspapers describe as the train spotting generation, people who initiated into heroin use in the 80s, 90s, and who are now aging but still continue to use, that they're a population with severe multiple disadvantages or multiple and complex needs, homelessness, recent incarceration, destitution. Many of them were street homeless. Why did they inject in public places? Well, they described really urgency of withdrawals. So they spent their time in the city centre raising money to obtain drugs, then obtaining drugs, and then quickly using, because by then they were in withdrawals. They were desperate, they described themselves as being. They described some of their environmental and circumstantial aspects being such that they wouldn't want to inject in public places compared to the other options they had. So, for example, I had to go down below a bridge to inject with other using addicts. As a result of, if I get caught doing it in the hostel, I would have been papped out. Papped out, for those who are non-Glaswegians, means they've been asked to leave. And so there's obviously, for all of them, they were actually doing a risk assessment all the time, and they were risk assessing, the need for immediate use, the lack of privacy, and actually, in some respects, the safety of injecting with others compared to the need for privacy or dignity and shame. We did a work around where were the geographical hotspots, and this isn't a great map, but basically the four, so green, blue, pink and yellow are the four quadrants of the Glasgow city centre, and in the centre is somewhere around George Square and Queen Street Station, and the hotspots are really the the southeast quadrant. So heading from the city, Merchant City, down to the Tron Gate is where this sort of behaviour is most often experienced. And this was a data source was from drug-related litter from our Land and Environment Services. But if you looked at police data, if you looked at injecting equipment provision data, it all marries into this. You'll see, though, that we've got a bit of a pizza wedge going into the Calton area. So it's not just confined to the city centre, it moves slightly outwards into the east end. And a lot of this is related to the routes of supply of drugs. So there is one supplier of drugs, particularly in the Calton area, who people use as they supply, and that has an influence on where the hotspots of public injecting are. So the report made a number of recommendations around intersectoral coordination, peer support networks, meeting the specific needs of these populations through our current alcohol and drug and other services, and around closing some gaps around injecting equipment provision. And I don't have time to take you through all of these. The other recommendations were around new service responses. So we wanted to then start collecting data and ask the question around public injecting in our data systems, but also that we should pilot and evaluate the impact of new facilities, safer injecting facilities, also known as drug consumption rooms, and heroin-assisted treatment. So since we've published the report, actually there's been widespread support between the medical and public health professions for this. And we are currently implementing heroin-assisted treatment, which will now be active in Glasgow City towards the end of this year in Hunter Street Homeless Health Services in Glasgow. We're going to be the first such service in Scotland, though it has been used elsewhere in the UK. But a drug consumption room is a totally different matter. Okay, so we've called it a safer consumption facility. So we've changed the name partly because it's not just about injecting, but new facilities are about safer other methods of drug use, such as inhalation and smoking of drugs. So what is a safer consumption facility? Well, it's in a hygienic environment where illicit drugs, and this is the key, where people can bring their own drugs purchased off this premises, and those drugs can be consumed under clinical supervision. They provide a sterile injecting equipment and other, for example, pipes and foil for those who smoke or inhale. They provide overdose assistance, crucially, and there's not been a single fatal overdose in any of these sites across the world. And they provide on-site health and social services to active drug users. There are over 100 of these facilities, so I've lost count of the number now. I can't give you exact number because there are new ones opening all the time. I get invited to go to conferences and speak about the Glasgow proposal, and before me I'll have somebody who'll say, we just opened our new one in Ottawa, and after me I'll have somebody saying, we evaluated our one in Kiev, and I'm like, yeah, we've been talking about it for 3 years and 4 years in Glasgow. Yeah. So they're a very well-established response to similar problems in urban populations all across Western Europe, Australia and Canada, not the USA, of course. The evidence base is that they definitely engage the target population, they reduce sharing of equipment, injecting equipment, they reduce public injecting, they reduce drug-related litter, and they help people engage with addictions and other health services. In terms of secondary outcomes, they reduce drug-related deaths in the vicinity of these facilities. They reduce blood-borne virus transmissions for those who use these facilities, and they're associated with considerable cost savings, and particularly from, and this is most well studied in the Australian and Canadian evaluations of drug consumption rooms. They do not have an impact, positive or negatively, on crime or disorder around the site. They don't have a honeypot effect. People from Aberdeen who are in withdrawals but have managed to score heroin will not catch a train down to Glasgow to use a Glasgow drug consumption room. It's unlikely that anybody from Kilmarnock will do that either, because of that immediacy around use. And also, drug users don't want to be picked up by police with a bag of heroin and traveling for too long. The public are usually hostile to one initially, but after about a year, public and businesses become very positive about them and actually take ownership. So where are we in Scotland? So drug consumption rooms, safe injecting facilities, whatever you want to call them, are actually illegal in the UK law. The Misuse of Drugs Act would be contravened by such facilities, particularly because of the laws around possessions of illicit drugs in such facilities, and our staff and our corporate bodies would be prosecuted for facilitating drug use as well. The police have said to us that they will support us if we have the right legal framework in place. We thought that our Scottish system would allow our Lord Advocate to give us, in simple terms, a prosecution waiver because of the public health case for this. But the Lord Advocate declined to do so, citing that actually this was a complex legal issue and that we should ask for changes to the primary legislation, which is the 1971 Misuse of Drugs Act. That is a Westminster reserved piece of legislation. The Scottish Government, Glasgow City Council, Glasgow City IJB are all in support of our proposals. They can understand the public health case, but Westminster has declined. And it doesn't show any appetite to change its mind at the moment. So there's currently... You'll understand that the current political situation is somewhat complex. So this, and I'll be careful with my words, plays into the current sort of issues around devolved, non-devolved, Scotland, London. You get what I'm saying? As well as the complex of legal issues that underlay this. But there is a cross-party support for this in Westminster as well, and there's a lot of work going on. I mean, this is old now because, you know, how many Prime Ministers have we had in the last... So, yes, so there is considerable pressure, and I'm sure when Mr. Johnson has some time, he will be asked to support this as well in due course, and hopefully we can get it over the line, because as I said at the start, I very much believe it is a proportionate response to a public health emergency in the city. Thank you.